Good evening and welcome to Living with COVID-19. I'm your host, Andre Pitts, and I thank you for joining us this evening. Belize's COVID-19 cases have enjoyed a decline recently. We can credit that to our collective support of the various measures and protocols that are in place to curtail movement, limit gatherings, and to promote great hygiene. It's still not time for us to put our guards down though, because while it takes months to flatten the curves as they appear, it only requires a few hours of carelessness for the numbers to explode. So let's keep at it, folks. We've learned to adapt, to do without certain vices and luxuries, and for the most, we really have, like our show is named, accepted that we will be living with COVID-19. We recently had an opportunity to interview a man who has a tragic COVID-19 story to share. His brother contracted it, and then he did. His mother, his sister-in-law, and several other relatives caught it as well in a short period of time. And unfortunately, several of them lost their battle with the disease. Viewers, this is what Mr. Edwin Yakab had to say to us about his COVID-19 experiences.
Right now, I'm feeling kind of tired. We have been dealing with some family stuff, and this morning we received a news that one of my cousins also died, probably from COVID as well. As far as we know, we cannot really tell who got infected first, right? But if we base ourselves on symptoms, maybe we can say my brother Elias Yakau, who died on the 22nd of September, which is like 3 months to exact today. And he didn't have much of symptoms. He only had the short of breath. He couldn't breathe properly. And he didn't have headache, he didn't have vomit, he didn't have diarrhea and nausea. But most of all, it was the short of breath that he had difficulty with. And it wasn't long, like 4 days before I took him to the hospital. And I think they did a rapid test on him, and he came out positive. And on the following day, all of us were being tested, swabbed. So he was swabbed on that day, and on that same day, he was taken to Belmopan, and then on a few hours later, he was admitted at the Carlisner Memorial Hospital in Belize City. And from there, ever since, we didn't have any contact with him at all. He was isolated. If he had any chance, he just sent us a message or a picture to show us that when he was doing okay. He couldn't talk because he was under heavy medication. But after he was there for 4 days, if I'm not mistaken, and then one morning when I called the hospital because I sent my brother a message on his phone, and he didn't answer it. So I called the hospital and I inquired about my brother, and I was told that he was intubated in the morning. And from then, every day I called, and I was told that he was doing okay some days, and then other days he was not doing that well, until finally the day that he died in the morning, about 11 in the morning, the doctor told us that we need to prepare ourselves for maybe his death, because his kidney was failing already, and he had a blood clot, and he had a bacteria in his lung. So he was deteriorating. His health was deteriorating fast, and by 6:45 on that same day in the evening, we received a call that he passed away. And 2 days. It was on a Monday, the 24th of August, that I took him to the hospital, and on the 2nd of September, I was admitted in this San Ignacio Community Hospital as well, and I was there for 3 days. Uh, as I was coming out of the hospital, my dad was being admitted as well, and he stayed there for 4 days. And then my sister, one of my sister-in-law, my mom, well, we were very ill. We had most of the symptoms, which was high fever, coughing, short of breath, um, headache, nausea, diarrhea, and loss of taste and smell, loss of appetite, and we couldn't even walk like a short distance because we were already tired and we were gasping for air. On the 14th day after we were declared positive for the first time, we were swabbed again, and most of us were still positive. And I can recall me being swabbed 4 times before I was declared negative. One of my sisters, she was swabbed 6 times before she was declared negative. She was the last one who was declared negative. And even we were declared negative up to today, we still have some side effects of the COVID, especially me, which were when I was admitted in the hospital. I I stool blood and I urine blood. I spit blood, and I had, according to the doctor, severe lung infections and kidney infections and stomach infection. And I was given a lot of medication. And besides that, we were drinking people recommend us, like herbs and ginger and all this stuff. Well, in my case, on my dad's case, we were admitted quick. As soon as we reached, we told the nurses that we couldn't breathe, and they took our saturation and noticed that it was very low, so we were admitted quickly. On that, I don't have a problem. The only problem that I am in I have or I'm in disagreement with is that the day that I took my brother for the first time, he was not admitted and he was not even taken care of. He was sent home. And financial wise, it's very difficult and worse because when we went to check on um, the hospital bill for my brother, we were told that we need to pay almost $24,000, which I find it um, what's the word I can say, which I find it very frustrating because we were expecting we had to pay, but not that much because every time we used to see on the news that government got so much financial assistance for COVID survivors of COVID pandemic, and we didn't get any assistance at all, and we're trying to figure out who can help us, and we have our hands tied because when I asked the person in charge in the hospital, and I asked if there is a program where we can get any help, and she told me we just send the people to the area representative, to the minister. So some people, it will not affect them as much as it affects others, right? But I can say that in my family and in my case, it did a very pretty job on the health issue, right? Where we had we need to wear our face mask, even though many of us, I was one that was in disagreement of it, and even though I was in disagreement, I still use it because it was the protocol, and even by taking care of myself, I sanitize my hand properly. I have paper towels in my car and alcohol, hand sanitizer. I sanitize my taxi every time someone gets a customer gets out of the car, and even still, even though I do all those things, I still get infected. So if by protecting ourselves we get infected, imagine if we don't follow protocols, if we don't protect ourselves, it's going to be much worse. And if once you get infected and you find out that you're positive, please stay home. That's the best thing to do. So and that's the only way we can stop this pandemic.
Viewers, I'm sure you agree that that interview was very, very sobering to hear and heart-wrenching as well. Like all the experts have repeatedly said, the virus affects different people differently. Some have no symptoms, some have mild symptoms, and then there are those who end up have to fight for their lives, literally. And unfortunately, some, like members of the Yakab family, don't win the battle. That is why we continue to stress, keep your guards up. It's not worth risking your health and finding out the hard way how your body will respond to the virus. Viewers, on that note though, we'll go for our first commercial break this evening, but stay tuned because we'll be right back with a second portion of our interview with Dr. Manza and some COVID info to share from the Minister of Health. Hello and welcome back to Living with COVID-19. I'm your host, Andrea Pitts. Last week on our show, viewers, we heard from Dr. Manza, who stopped by to share his own experience with COVID-19. We were having too much fun and ran out of time, so we're going to show you part 2 of the interview now, where he told us a bit about the COVID-19 vaccine and what Belizeans should anticipate.
Even if vaccines are available for a good amount of the population, I don't know that the prevention measures that are currently being encouraged, which talk about adequate hand washing, the physical distancing, and the proper wearing of a mask, are going to be just thrown out the window. I don't think those will disappear. I think those will be there for the Belize context, and as are for many other developing countries. I don't know that the expectation is to have in the initial phase 95% of the population vaccinated. I think we're looking at 30% of the population, and you will have to follow established international guidelines of who are most at risk. And so, of course, the healthcare workers, frontline workers, will be the first ones to get those doses. So you're talking about the 30% of the population. That doesn't mean your entire cohort in Belize is going to be vaccinated. So I don't know that we should be anticipating that with the vaccination process, once it gets started, it means everything goes back to being normal. I don't know that any country has actually said that or is in a position to do that. I know Israel is very much ahead. I think they, along with United Arab Emirates, are closest in terms of doing massive vaccination for their population, not just frontline workers. But even our neighbor Mexico, which is a country that has started in our context, they have vaccinated less than 0.5% of the population, and they are only doing healthcare workers for the time being. So even that can be a nightmare if it's not properly planned and structured with given time frames. The latest note I got is that the vaccine would be able to cover you for a year. So it would be that you probably will have to get the vaccine just like when you get a flu shot. So I don't know that gives you long-term immunity. You will have to have the same perhaps coverage as you do with other vaccines in order to talk about eliminating, eradicating a disease. So I don't know that for our context that is going to happen this year with what is anticipated will be done when the first vaccines are available for Belize. The last note I recall when discussing with PAHO and colleagues in the Caribbean region would be that it would be towards the second or third trimester of 2021. That's for the context in which Belize sits in. Okay. Because like Mexico, they are doing way before the COVAX facility had even been established. I know that they were in discussions with these major companies, and payments and disbursements were done even before the vaccine was actually available. So they actually invested in that. And so countries that have the ability to do that, well, I think those are the 20 plus countries that are now having access to the first batches of vaccines. Now, I know that there's lots of doubts being cast upon vaccine development and the relative quickness with which it came. But the situation, I think, has to be looked at from the fact that there had been work done and there's work that has been ongoing with these types of viruses. The mRNA vaccine, which is what was developed in record time, as you call it. There's been lots of work that's been done with viruses such as the SARS-CoV-2, because there's a MERS virus, which is same family, if you will, and of course the SARS virus, and of course all the work that has happened with other flu-like viruses. I think that is what has allowed the vaccine to have developed in record time. So it's not that things started from scratch. I know people are saying, but HIV has been there for longer, but not more has happened. But this is a virus that has been studied, and there's much work that has been done in that light. And so when vaccines started to be developed, it was piggyback basically on the groundwork that has happened with this particular virus. I don't know that it is going to be widely available for the general public once it gets here. So I think we have to follow the process and who will be the first people to actually get access, which, as I said, I think it's going to be the healthcare workers, the frontline workers.
As Dr. Manza shared, Belize is a part of a broader coalition of countries that are procuring the COVID-19 vaccine. In fact, a few days ago, the Minister of Health and Wellness, Honorable Michelle Shabat, offered the media a brief update on vaccine-related matters. This is what he shared.
We signed on to the COVAX facility, and we are still in discussion with PAHO to determine exactly which vaccine will be coming into the country. They have said to us in the first quarter of this year where to receive it, but we're still waiting to see exactly which date it will be arriving and which one. We have paid for 30% so far, but we are not sure yet if we're going to be receiving the 30% in one shipment or over time. This is still being worked out through PAHO.
So according to the minister, Belize will be procuring COVID-19 vaccination for up to 30% of our population, hopefully sometime soon. How and when it will be rolled out should be announced by the ministry sometime soon as well. On that note, we break for our second commercial break for the night, and we'll be right back with our wrap-up for tonight. Good night, and thank you for staying tuned in to Living with COVID-19. Earlier this evening, we spoke to Mr. Edwin Yakab, who recounted his own COVID-19 experience and that of his extended family. Many of them were also ill with COVID-19 as he was, and unfortunately, multiple of his family members have passed away. He shared the importance of seeking medical attention as soon as there is any difficulty with your breathing. And he also advised that we not let down our guards when it comes to the measures that are in place to protect our safety. Until then, and even when that time comes, we will still be required to wear our face masks, keep our distance, and to maintain great hygiene. Dr. Manza did mention that herd immunity is not exactly an overnight process because we still have a long way to go. Until then, our best is to continue mastering the art of living with COVID-19. Viewers, that is it for our time today. We thank you for joining us and hope that you continue to stop by. Living with COVID-19 airs on Mondays at 7 p.m. on CBTV and on our Facebook page, Colorblind Multimedia Productions. Until we see you again, please remember to remain safe, remain informed, and remain healthy. Good night and see you again soon.